A warm welcome from me to everybody. Before I start my lecture, I would like to thank you, the organizer, for inviting me to talk about vitamin D. We have heard about several problems, several diseases about vitamin D, but I'm going to show you that the problem is much, 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 much bigger. Not only in Japan, also in Germany, and it's worldwide. We have a huge problem. I skip this, what I've been doing all my life before. I just started to go into the details. This has been published by the WHO in 2015. We have an increase in life expectancy of about 6 years. It's extraordinary. We're going to get older and older, and huge thing. But on the other hand, only 4% of the world population are without health problems. 4% of the population, not more. 33% have more than 5 health problems. We start in medicine to wonder about comorbidity. You do not have one disease, not two diseases, but 3, 4, and 5 if you are 65 or 70 years old. So that's no quality of life. 50% increase in the risk of healthy life and 40% increase of diabetes. Only diabetes, 40%. So there is an increasing problem of diseases worldwide. How does it happen? How can that be? There's another story coming up. 2018, the WHO has published non-communicable diseases, that means non-infectious diseases, are by far the leading cause of death worldwide. 41 million people, that is 71% out of 57 million people, are due to non-communicable diseases. And what are these diseases? Cardiovascular disease, cancer, chronic respiratory disease, and diabetes again. So all these diseases have not existed. All these diseases have developed in the last 30, 40, 50 years, and all of these diseases are homemade. They are lifestyle bound, and we are producing these problems. I'm going to show you. Remember this 71% out of 57 million. This is worldwide, also the poorer countries like Africa. If you look at Japan, we found 82% from non-communicable diseases. And if I look at my home country, in Germany, it's 90% of all death coming from non-communicable diseases. 90%. Only 10% for accidents, for something else. The rest is non-communicable diseases. So this is the yearly toll for the technical progress of civilization. Again, we are producing it ourselves. Look here, the effect of technical progress. This is communicable disease, infectious disease, hepatitis, rheumatic fever, mumps, measles, tuberculosis. All this has been going down in the last century. And parallel to this process, since 1950, multiple sclerosis is going up, Crohn's disease is going up, type 1 diabetes is going up, asthma. All these diseases are going up, steeply going up, despite the technical progress, despite the medical progress. We're getting sicker and sicker and sicker, but by a completely different causes. Last century, Mike in biology has said that nothing in biology makes sense except in the light of evolution. And I think he is right with that. And we have to extend that and say nothing in healthcare makes sense except in the light of evolution and environment. The environment is an essential resource of health for us. So if you look at the environment, what do we have here? The most important source of health is the sun in the environment. There would be no life on Earth without sun. It would be cold, extremely cold. Nothing would happen without the sun. And today, dermatologists tell us you're going to die from sun. No, we are going to live with the sun, but we have to live with her and not against her. So everything in the evolution was going forward due to the environment, and it's only possible with the environment, not without the environment. So we have to take care of this, what the environment also gives us as resources. And this happened in the evolution until man came up on the scene. And he started 10,000 years ago to change the environment. He started with agriculture, he had weapons, he had tools to change his environment, and he got sick. So with agriculture, the whole process started. That is the dark side of the Anthropocene. We are so proud that we are imprinting ourselves, our culture, our style on the earth. But we do also start with a new generation of diseases. So if you condensate this is a human being, and we have been living in the natural environment for billions of years, and this natural environment has made us so perfect that we have been going around the whole world by food. The whole world. Today, most people can only work 500 weeks, 500 minutes. Then we have created a technical environment, polluting this one, and in addition, a new social environment. 10,000 years ago, we had another social environment which was much more healthy for us than the modern social environment, living alone and so on. So we have a lot of problems in the new technical environment, water and physical activity, overfeeding, omega-6 fatty acids, gene manipulation, social isolation, all these are problems. And this what we had when we were hunter-gatherers. Sunshine, vitamin D, relaxation, physical activity, undisturbed sleep, circadian rhythm, all these things, I'm going not to go to tell this all, but all these things were resources of health. We need it. Our organism, our system is related to these things. And if I lose these things, I'm going to get sick. So the majority of the positive historical factors got lost in civilization. If you read the studies from America or from Japan or Germany, always the bigger part of the population is on this side and no longer on this side. And this deficiency makes us sick, and this we call the nature deficit effect, because nature has given us these resources further. So today the topic is sunshine and vitamin D. But I could give the same lecture about all the other factors. We need them. Okay, if you put it together, health and environmental factors, we have been looking for the risk factors, cigarette smoking, pollutant, and plastics, and stress, and all this. But we forgot to look at that. And there are the micronutrients, the physical activity, and again, vitamin D, the solar hormone, social relation, to just have some. If this is in balance, we are healthy. If this is not in balance, if we put on here and take away there, then the balance gets out of. And that's the reason why we get more and more sick. So this is well known, all the risk factors, which we know for a long time. In addition, there comes also the electrosmog, another topic, and we have to get balanced again. If we look at the historical story of vitamin D, we have heard about bone, and many scientists say vitamin D is only for bone, but it's not true. If you look at evolution, vitamin D, the endocrine system, was already there when we were still swimming in the sea. And later on, when we came to the land and developed skeleton, then vitamin D just took over also the bone metabolism, just as some additional task, but not more. The endocrine system was already existing here. And this is the explanation why vitamin D is so important for our body in the sunshine. So, it is a pre-hormone, not a vitamin D. And we do not have to eat it, but we can produce in our skin. In parentheses, as long as we go to the sun. If we don't expose our skin to the sun, it won't work. More than 2,000 genes are regulated by vitamin D, and they improve more than the bone and muscle function. 17 kinds of cancer. We heard something in there. 17 kinds of cancer. It modulates the innate and acquired immune system. So it's essential for very important functions of our organ. And it protects also the cardiovascular system. Why? There is no cell in the body without a receptor for vitamin D. And if a cell has a receptor of vitamin D, it needs vitamin. And nobody is going to die because he has not enough vitamin D. But the cell function goes down. And if in addition to the lack of vitamin D, you have bad food, and you are smoking, and you are not doing physical activity, you have risk factor and risk factor and risk factor, and the multitude of risk factor, then they put the organism down, and then we get sick. So you saw already about that. That's from the last century. We had already such a problem with the vitamin D addiction because people were living in the cities, and there was dark smoke and so on. And was also already vitamin D deficiency. We have today again. This is a report from Japan, and we see that the rickets are growing in number. Yeah? It's not the number so much, but it's a percentage. It's going up. Why? Because the deficiency is also going up. Luckily, there was the Japanese Society for Bone and Mineral Research. They put out the criteria for vitamin D levels, and they put them up to the latest level, international level. So that means we need a level of about 30 nanogram per ml. That's sufficient, or less than 20 to 30, it's insufficient, and from 20, below 20, it's deficient. That's the international characterization. But please, the level of 30 nanogram, that is the same as a lower level in your car for the oil, the motor oil. Nobody runs a car with the motor oil at the lowest level. You put a liter on. Please put a liter on and go to this area here, 40 to 60 nanogram per ml. Then the sun is shining. If you are between 30 and 20, the weather is a little bit cloudy. But if you are below 20, it's bad weather. You are going to be sick. Not tomorrow, after tomorrow, but 10 years later. The epidemiological studies show that if you have vitamin D level, high vitamin D level, low level, and you see the curves go steeply up, but it's not health, it's disease. It's a hazard ratio for death, and it's going up like that. And this in all the different studies, be it cancer, be it cardiovascular health, it's always in this area that the curve changes and goes up. So we have enough documentation that we should have at least these 30 nanogram per ml. This is a distribution of values of adults in Germany, and you see, if I put here the 30 nanogram, almost all the population is on the wrong side. That's a deficit, that's normal, and what comes out, 12%. And this is not only in Germany. If you look at, this is still the same data, the same data in Germany, but this is the age distribution. This is the more small children, the toddlers, and this is the aged people. And you see only the smallest children, they have a normal value, and the rest of the population is deficient. How can that be? Just the little ones? They are supplemented. In Germany, all the little children get supplement vitamin D. 600 EU, but for 6 kilograms, that's enough. And they have very regular values. But after 2 years, then the pediatricians say, it's no longer necessary. The children are going out to play outside. They have sun and they make vitamin D. Last century maybe, or in past time, but not today. They are playing inside. PlayStation, computer, and without supplementation, they lose their vitamin D level, and they are, as the rest of the population, they are down. We know what happens to the adult people when they have not enough vitamin D, but we do not know what happens to our children when they are without vitamin D. So this was the population 2007, that was 20 nanogram per ml appropriately. And this is what we need. And if you look, to the Japanese population, was published in 2013, the men had 22 and the women had 82. So that's exactly the same level as we have in Germany. And you may look also for India or Arabia. Wherever you go, it's no longer the problem of the latitude. It's a problem of lifestyle. If you sit inside instead of working outside, if you use sunscreen and protect yourself with an umbrella, you cannot produce vitamin D, and then the whole population is down. What are the special properties? Well, there are some signs of deficiency, but they are not typical. It's excessive sweating, it's bone pain, it's overweight, it's digestive problems, but they are all not specific. So you cannot have a clinical diagnosis of vitamin D. You have to estimate vitamin D value in the blood. This is the story of vitamin D and bone. We know today that also the muscle needs vitamin D, and if you have a strong muscle, you will not fall, and if you do not fall, then you will not break your bones. So it's a double effect of vitamin D in this system. And this chart is a little bit overload, but it shows you that vitamin D is working in the cellular level on the genes, and already in the womb of the mother, and the rest of the whole life, from the toddler to the old age, you need vitamin D in every part of your life. During pregnancy, it improves the fertility already before pregnancy. It supports the implantation of the fertilized egg, it preserves a regular course of pregnancy, it supports fetal growth, and it controls the secretion of multiple placental hormones. So it is essential for regular way into our life. And it limits pro-inflammatory cytokines. In US, the problem has been established earlier, and they started earlier to fight against it. And there's a lay organization, Grassroots Health, and they managed, together with the University of South Carolina, that all women, meanwhile, this was a study, but all women, meanwhile, get 4,000 international units of vitamin D, and what happens? Minus 50% preterm birth, minus 30% of infections during pregnancy, and minus % diabetes, number one, high blood pressure and preeclampsia. So not only the mother needs vitamin D, but also the child in starting his growth. And if there's enough vitamin D, it works, and if not, it works not. Metabolic disorders, diabetic and cardiovascular disease, we have already heard a little bit about that. If you have a metabolic syndrome, no, this is heart disease. Sorry, can you put it on again? Okay, if you have a now we are there, pop. Metabolic heart. Okay. If you have metabolic syndrome, that's the beginning of diabetes, then you're going to die someday, even if you have enough vitamin D. But if you look at this 10 years follow-up, and there are maybe 10% of the population without or with enough vitamin D are going to die. If you have low vitamin D level below 10, then it is 40% of this population who dies. They have the same disease, but fourfold death rate if you have vitamin D deficiency. And the same is true for cardiovascular disease. Every circle is a study, and you see there are a lot of studies here, and again, below 30 nanogram, that's 30 nanogram, the hazard ratio goes up, and the probability that you get sick or die goes up. Diabetes, it's again Grassroots Health. They have a lot of followers, and they take so much vitamin D that have a level between 40 and 60 nanograms. And this is the Nihans cohort. This is a typical American. They have 9% of diabetes, and the people of the Grassroots Health cohort, they have only 3.4%. That means they have 60% less vitamin D because they have another lifestyle. So you can just avoid diabetes by having vitamin D. You have a lot about oncology, cancer risk, and this has been a study, double-blind, placebo-controlled, like a drug study. And what came out? Risk reduction 80% during 4 years. So it's worthwhile to do it. I won't go into the details in cancer, but it is working for or against cancer because vitamin D has effect on tumor genesis and progress. It inhibits the proliferation, angiogenesis, sensitizes apoptosis, and uses epithelial differentiation. And not only that, but it also influences, 2019, the microenvironment. Now I'm back to the start of my talk. We are depending on the environment, and also the tumor is depending on the environment. A tumor cannot grow in a healthy body. Only if the body is sick and the body is not able to defend itself, a tumor can grow. And vitamin D helps in the tumor microenvironment that the tumor cannot grow. So in each stage, it works. Breast cancer survival. Again, a study, prospective study, controlled study. 2,500 patients got supplemented, the other didn't. And what happened with breast cancer patients? 49% reduction in breast cancer-specific mortality. So even if you have a cancer, it's worthwhile to take vitamin D to get up a normal value, and then you are well equipped against cancer recurrence. Immune system. It protects against allergies and autoimmune diseases, Crohn, diabetes type 1, and rheumatism. Why? Because the immune system is tuned in the womb of the mother. If the mother has enough vitamin D, the immune system is tuned correctly. If there is not enough vitamin D, then these allergies come. And this, I'm not going into details, but this is a complicated immune system. And you see vitamin D, in this case, it lowers, it goes up. Goes up, lowers, lowers, lowers. So each kind of immune system, immune cell, is tuned differently by vitamin D. So it's a very complicated system, and it works by evolution. This one I need not explain, you have heard it. You have the author sitting in here, it worked. 60% reduction for influenza A and 80% reduction for asthma. How is that? It's simply working. If you have a good immune system, you don't get influenza. And if you don't get influenza, you get not an exacerbation of your asthma attack. So you're living quiet and comfortable. So it's very important to have enough vitamin D to fight influenza, and then you profit also for asthma. This is another study. It shows that in the beginning, without vitamin D, most of the people had to go to hospital once a month because they were in a bad shape. After 6 months, there were almost no children going to hospital every day. They had no visits. They improved extraordinarily just by vitamin D. Not by drug, but just by vitamin D. All the neurological diseases you have heard about depression and so on, all these diseases respond on vitamin D. Why? All nerve cells have receptors for vitamin D. If they have the vitamin D, they work. If not, they cannot work. This is a new publication, 2017, potential environmental risk, multiple sclerosis, schizophrenia, and autism. So all these mental diseases are also partially due to a problem with vitamin D. Toxicity, well known, always fear, 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 don't take so much vitamin D. It's not true. This has been done by Canadian colleagues. They gave a lot of vitamin D, 7,000 microgram per week, to multiple sclerosis patients, and they showed that the level actually went up extraordinarily. Nobody wanted to have this. This was an experiment. And the question was, goes calcium up or not? Because the problem with vitamin D intoxication is high calcium. So you control the calcium, or what you see, this is the baseline in another lecture, and you see, even with a high dosage, nothing happened. There's some variation, but nothing happened. So the fear against intoxication is not true. You have to take the 10-fold daily dose for weeks, for weeks, for weeks. Then maybe you get in the wrong direction. What should we take as a thumb rule? Suckling babies, 400 to 600 units per day. The children, all children should get supplemented depending on their weight. When they have 70, 80 kilograms, they should get a regular dose. Adults should also in the summer supplement because it is not enough. And the best thing is to take all year round vitamin D. this is also adults, in wintertime, at least 4,000 units. And if you are pregnant, you should take also 4,000 units without harm to the children, but with a big benefit. And if you are breastfeeding, you should take 6,000, because if you have enough vitamin D as mother, you can put it into the milk and the breast milk, and then the child has enough vitamin D. So I show you this slide again. Remember, that's 2007 German population, all deficient, and we had a chance to look at the same population 10 years later. And what comes out? This. All the adults from 50 years on, they almost reach the normal values. If we calculate that, we get 8 nanogram per ml, 2017, more than we had in 2000. How did that happen? Sunshine? No, supplementation. We have been informing the public that they are vitamin D deficient and that they have a chance to get rid of the vitamin D deficiency by taking a supplement. It's not the government who has done that. This has been the people themselves. If you give the people the knowledge, they can act free and can improve by this. Okay. My conclusions with regard to vitamin D are the vitamin D deficiency is found all over the world because people live almost all over the world in the same wrong way. Vitamin D, the solar hormone, is a precious and effective tool to defend the body against almost all diseases. It's not the only one, but it's one of very high importance. Everybody should know his vitamin D level, and I have to confess I was very impressed that you are not measuring your vitamin D levels, that the social insurances are not paying for that. They also do not do that in Germany, so the people go themselves to a doctor or to a lab and say, I want to know my vitamin D level. And as expected, they are down, they supplement, and it works. So try to get available the vitamin D estimation. And the reference range should be 40 to 60 nanogram, because then you can be sure you have enough. And if the sun exposure is insufficient or you have no chance to go there, then supplementation is recommended. It's not the best solution, no question. It's far better to go to the sun, because the sun has still more radiation and more effects. But these effects are difficult to get. But supplementation is very easy and extremely priced. So, take-home message: environmental factors are essential for our health. We are depending from our environment. The mismatch between the natural environment and the modern civilization is our problem, the cause for most communicable diseases. And medicine is not able to overcome this problem, because medicine has no chance to get into lifestyle things. So the consequence is that we have a new health culture to procure that the people behave correct in all the settings, families, kindergartens, and companies, wherever we are. If we have a good health culture, then we have less medical problems. Thank you so much for your attention.
シュピッツ先生、ありがとうございました。